Ladies and gentlemen, please welcome to the stage Dr. Kenneth J. Rosenthal.
First, let me just tell you a little bit about the foundation that we formed just a few short months ago. And like any newborn, which is what this foundation is, it has all kinds of potential. We started this foundation because there is, I perceived, a need to raise funds for patients who require care that is outside of the system. Do a lot of cutting-edge work, a lot of work that is not yet approved by the FDA, a lot of investigational work. What we found is that patients, it was frustrating because I knew I could help patients, but the cost of the technology was prohibitive, and the cost of hospitalization and aftercare was very expensive, and even when I donated my own services, it was still beyond the capability. So we have a large number of patients who have not yet received care and who need it. This revolves primarily, or at least originally, around an invention that I came up with a number of years ago, and that is an artificial iris. The iris, for those of you who don't know, is the dark part of the eye and regulates light coming in the eye. When patients don't have this, they can't see. They're visually debilitated. And we're going to hear from actually one of my patients in a few minutes about how that went when he was able to have the surgery. So a few other examples of this, and this is in your program too, is, for example, a young soldier who came to us through Walter Reed Army Hospital, and who had serious injuries in the Iraqi war. He was completely rehabilitated, but he was missing the iris in one eye. He could not have surgery through the VA system or through the Army because they wouldn't pay for it. This was investigation. So we're raising funds in order to help patients like this, but we see a lot of potential for this organization in terms of raising funds and supporting research for all kinds of eye-related care and at the cutting edge. We are looking for board members. We're looking for people to donate, to participate. So if you think that you can make a difference and you want to discuss, please feel free to grab me at the reception, to speak to my staff, and talk to us about that. Before I go any further, there's a few people I want to thank. There are a lot of people I want to thank, but I'm only going to thank a few because of the time. The first is Fran Roberts. Fran is our conductor tonight. She also happens to be a patient. And a few months ago, a number of months ago, she and I started bantering around this idea of doing some performance together. And we also talked about the foundation because she's been a recipient of the system in terms of being able to benefit from surgery. And we decided to do this tonight. Fran has been tireless, patient, not only in terms of the music, but in terms of offering advice for running the concert, running the foundation, and we really appreciate her. I want to thank Abraham Sternclark, who's sitting here in the front row, who will be joining me as a duo pianist. He's also been my teacher since I'm 7 years old, and a composer, marvelous composer in his own right. He has also been very patient and generous with his time in terms of rehearsing with me and giving me very valuable advice for the concert. I want to thank Laura. Where's Laura? Laura Massetti, who helped to organize all of this, and most of you know who she is because you've had some contact with her. And last but certainly not least, I want to thank my wife Cindy, who's sitting over here, simply for being her and for being patient and understanding and for giving so much of her time to the foundation and to help us. So, I said to you at the beginning that we have a special guest tonight. His name is Nathaniel Schull. Nathaniel is one of the first patients to receive the new type of iris implant, He also happens to be a fellow musician and pianist, and he's studying music at college now. And I'm going to invite him. Nathaniel, where are you? Come on up. I'm going to ask Nathaniel to come up and say a few words, because when you hear from him, you will understand why we started this foundation and why this was so important.
Hello, everyone. I really want to thank everybody for being here tonight. It's really an honor to be standing in front of everybody. I know that Dr. Rosenthal wanted me to talk briefly about the surgery and what it did for me and my life and how it changed it. And this foundation will really help to change other people's lives as well. I personally, when I was younger, was not able to do a lot of stuff that most people were able to do. I always had to wear glasses when I was outside. Whenever there was like fire drill or something like that, I always had to have my friends cover my eyes because I didn't have my glasses on me all the time. And it was a really big pain because inside or outside, it always gave me headaches. And as long as I can remember, I've had multiple problems with reading, with just in general seeing. And once I found out about Dr. Rosenthal and what he was doing with this, I really talked to my mother about it, and I realized that it was something that might really change my life. I was worried about it at first because it was something new, but as I went through the surgery, I started to realize how much it changed my life. And something I said when other people asked me in an interview about the surgery was that it was kind of going from watching a fuzzy TV to a sharp, new LCD TV. It was like one of those old tube TVs to a really nice, clear-cut vision. And I couldn't tell you, it's kind of a miracle in a way to tell you that the things that happen to me, I'm able to drive now because they told me before I wasn't able to. I'm able to fully, completely read my music, be able to do more reading than I used to be able to. I can walk outside without my glasses, and I can go outside with my friends, and I don't have to feel like a creep anymore. I can enjoy my times and not worry about headaches or constant pains with my eyes. And what I really enjoy about it is the fact that I can feel normal. Now, people could say, obviously, you are normal, but in my own perspective, it felt really weird to be around other people that were able to do this, and I wasn't. And it's also cool because right after the surgery, after you check my eyes, I went from, I believe it was 2100 and 2080 to 2040 and 2030 people plans. So it was a big difference, and it really, really changed my life. So this foundation really helped to really change other people's lives, and I'm really honored to be here today to have you guys here and listen to Dr. Rosenthal play, and I really want to thank everyone, so thank you very much.
Nobody can say it better than that, can they? Thanks, Nathaniel. And I always owe a debt of gratitude to my patients for giving me the opportunity to help them in that way. Let's get on with the program. We have a wonderful afternoon of music for you, and I do want to remind you also that there will be a reception following the final part of the program, and will be upstairs. You can either take the staircase, which is just outside of the auditorium here, or there's an elevator just around the corner. We'll be up one floor, and please join us there. We'll have a chance to all meet. So, without further ado then, I'd like to introduce Fran Roberts and the Iris Chamber Ensemble of Greater New York. Thank you.